Good evening. I welcome you all for this webinar on behalf of Annamalai University and Madam Power. Today's webinar is on important topic on COVID issues. Dr. Vimal will highlight and enlighten with our queries and discussions. I am Dr. Malati, Director, Center for Skill Development. Skill comes into the role to increase the productiveness and quality of work for greater results. We, Annamalai University, pioneered to start these skill courses in 2015, and we initiated a skill course in the health sector to skill the unskilled youth, to facilitate employment, to enhance the livelihood by enhancing earning capacity, and to promote the skill development activities. And we offer 3-year BWOC BBA degree programs, and all the programs are approved by UGC New Delhi. So we run BWOC on airport operations, BWOC on aquaculture, BWOC on catering technology and hotel management, BWOC on hospital instrumentation and management, BWOC on mechatronics, and one another course BBA apprenticeship based program on logistics. We conduct many NSDC approved certificate programs. Few are radiology technician, general duty assistant, geriatric aid, X-ray technician, medical equipment technician, and also installation and service engineer. And we run courses along with NLC India Limited, Neyveli. In the skill education, the major part is collaboration with industries. Medam Power collaborated with us from 2015, and their role to give training for our students, to emphasize their knowledge and helping in their placement. I thank Mr. Rajan, who is our alumni of Annamalai University. Now he is the managing director for Medam Power. Today I invite you all for this webinar, and I should really thank Dr. Vimal for spending his valuable time and by accepting for this talk. So I hand over the session to Dr. Vimal. Thank you.
Thank you, Prof. Malathi. Good evening, everybody. I'm really grateful for all of you to be joining here in this YouTube live channel on this very important topic that we are going to discuss today, which focuses on the common man and coronavirus. Some basic announcements. I would be talking for about 40-45 minutes. If you have any questions, then please post it on the box on the right hand side. Any questions or anything that I tell you, if you have any doubts, then please go ahead and post your messages. I hope you're able to all hear me loud and clear. And my main aim is to try and give you some good knowledge about coronavirus that will help you in this situation of crisis. So let's get started. So, common man and coronavirus. I am Dr. Vimal Raj. For those of you who do not know me, I am a consultant radiologist who specializes in the field of cardiac and chest radiology. And when we hear about coronavirus or COVID-19, there are different responses that people have. Some of them are people who are really scared, who really do not know what is happening and they are worried about themselves. While there are some of the cool dudes out there who really say, hey, coronavirus isn't going to touch me, I do not worry about it. There are, of course, people who are also not sure what is happening, they are confused about it. The whole purpose of today's session is to try and give everybody adequate knowledge for them to be able to manage this condition appropriately and be able to tackle any problems that arises from it. The objectives for my session today are to tell you what is coronavirus and to tell people how does it spread. Then we will talk about what are the symptoms and what will happen to you if you get coronavirus. What can you expect to happen and what should you be prepared for? What should you do to stay safe? Then we will focus on treatment and vaccination. what is the progress in that field, and finally, we will answer some specific questions that people have in there. Well, let me start with a very simple disclaimer. I am a doctor and I think scientifically. Okay, I do not believe in every news that I see. I do not believe in every WhatsApp message that I see. And what I'm talking to you is based on my personal experiences and reliable sources of information and published robust evidences. There are news every day coming up saying a new vaccine has been invented. There is a news coming up saying there is a cure for coronavirus, and people are worried and saying, hey, why is it not available for me when it has already been discovered? So what you hear today is the truth based on reliable sources and on personal experiences. There are going to be some topics which I am going to avoid because I do not like to make speculation, or I do not like to guess about healthcare issues. So, what is coronavirus? Well, you should not be surprised when you hear that coronavirus is been there in the world since 1930. Okay, it was first discovered amongst animals in 1930, then it started affecting in humans in 1960. It's officially called SARS-CoV-2, which basically means it's a respiratory syncytial virus, and it is COVID type 2. There are 7 different types where people get affected from it. So for simplicity's sake, what has been labeled as coronavirus infectious diseases is COVID. COVID is the terminology that we talk about. It all started in December 2019, where few cases of respiratory tract infection, meaning people who came in with cough, cold, and fever, seem to have similar episodes, and there was a group of people who were affected by this, and they all presented in Wuhan province of China. And when they isolated the virus in them, they figured it out that this was a newer variety of coronavirus which is causing this infection called as the COVID infection. There was a lot of talk about seafood market being the primary source, but then guess what? More recently, when they tracked the first person who got infected, they had not been to the seafood market. This is a recent publication coming out saying the first person actually did not visit the seafood market at all. So where it came from, what was the background of it, it is unclear. How does it spread? Well, this is the most important topic that you all need to know about as to how does COVID or coronavirus spread. Basically, it spreads from one person's mouth into another person's mouth or nose, and this is usually through droplets. So when there are droplets, when we say droplets, these are nothing but when we sneeze, when we cough, there are particles which get released from our body, which travel and then can get into another person's mouth, can get into another person's eyes, or by shaking their hands, it gets transmitted from one's hand to the another person's. So this is how it spreads. Now, these droplets of an infected person, when they land on your face with a healthy person, you get this infection. A lot of people have been asking me, is it just that, or can it be transmitted in a different manner? The answer to that is yes. You know, every time we cough, we release up to 3,000 droplets, okay? But if we sneeze, we release up to 10,000 droplets, okay? These droplets can go and land on surfaces like plastic, cardboard, and stainless steel surfaces, and they can stay there for hours together. Recent evidence showed that some of these surfaces, it can survive up to 24 hours, especially cardboard. But then you look at plastic and stainless steels, they tend to be a little different from this, okay? Some people say it survives up to 6 hours, while some people say it survives even more than 24 hours. But what is very interesting is, as of this week, the news came out from the Center for Disease Control, the CDC in America, which basically looked at it and said, hey, the spread from the droplets into the mouth of a person or through the eyes is more common rather than us getting the infection by touching some other surfaces. So they believe that if you are able to avoid droplets of other people on direct contact, there is very less chance of you getting coronavirus by touching surfaces. If you touch a newspaper or if you touch a food delivery item, there are less chances of you getting this. Now, when we look at coronavirus, you need to compare it with some of the other viruses which have been in the system for some time. Now, if you look at coronavirus, the chance of one patient passing on the coronavirus to another person is around 2.5. So every patient passes it on to 2.5 patients, which is much more than the MERS virus, which was the Middle Eastern respiratory virus which had come. It is more than the Ebola virus and the influenza, which tends to happen every year. But it's much less than measles. When a person gets measles, they are likely to transfer measles to many more people than what would happen with COVID-19 in there. Now, having said that, if you look at the one person passing it on to two different persons, then the same person can pass it on to two different persons, and by a day you can see one person can be responsible for infecting numerous other people. So although one person passes it on to 2 or 2.5 people, eventually it stacks up and it can become a significant transmission in them. So what are the symptoms of coronavirus disease? Okay, so we've heard that this is how it is getting transmitted. What are the symptoms of coronavirus disease? Well, fever is the most common symptoms. Okay, people can also have cough and shortness of breath. You can get symptoms as late as 2 to 14 days after you get exposed to the virus. Okay, now this is a problem that we all face. We tend to get simple cough and cold. We can have flu as well. We can have general body ache as well. And we start getting worried whether we have got coronavirus or not. For example, my wife had been having some aches and pains in her body, and she was worried. Is this coronavirus? Am I suffering from COVID or not? Well, fever is almost always present. So that is something that one has to look at. Look for fever. That is very, very common. The next common symptom is cough. Most likely you will have a dry cough. Okay, you're not producing any sputum in there. Muscle pain or fatigue is possible, but they are more common. They are more common in people having general cold. The headaches is more common in people who have the flu. Shortness of breath is something that one needs to worry about. Okay, so the common symptoms that people will present are fever, cough, and shortness of breath. That's something we need to worry. This is what happens. Okay, you get exposed to the virus. Okay, somebody gets exposed to the virus. It takes about 4 to 6 days for the virus to build inside your body before you start seeing any symptoms. Okay, before you start seeing any symptoms. For some people, it can be as long as 14 days. So you get exposed to somebody and you're doing really well, and you think, hey, I'm great, I have no symptoms. But that could be just the incubation period that you are in. So one needs to be careful. However, even before your symptoms start, okay, let's say your symptoms are going to start at 6th day, about 2 to 3 days before your symptom starts, you are infectious. So if you develop symptoms today, it's not just the people who you've seen from today who needs to be careful, but some of the people who you've seen in the last 2 days may also have got the infection from you. Okay, so it takes about 6 days for you to start getting symptoms, but by about fourth day you are spreading the virus. Okay, the illness per se, how long do you have the illness? It differs from one person to the other person, but illness per se, it can be up to 10 days. Okay, 10 days is an average time, but some people can have it for 15 days, some have it for 20 days. And towards the end, when you do not have any symptoms, it's about 3 days for the symptom free period. That's when people remove you from isolation and you're free to go out. Often there is a testing involved at this point in time for your release. Now, what is the worst case scenario? What is the best case scenario? And what is the real life? Now, there are cases that you will hear patients were in the ICU, ventilated, they did not survive. While you will also hear the cases where the patient had been infected by it, they didn't even know about it, and they are doing extremely well. So there are going to be margins of well-to-do and not so well-to-do patients. So what decides whether you as an individual will do very well with this virus or whether you will not do well with this virus? The first and foremost thing is your health. Your current health without the virus. Are you fit and healthy, or do you suffer from asthma? Do you suffer from other medical problems that involve primarily your lungs? And also your age. If you are an elderly aged gentleman or a lady, then you are likely to have worse prognosis than anybody else. The second important factor, which is very important, is how early do you reach medical care? The people who reach medical care sooner tend to do better. Now let's look at some of the statistics. This is recent statistics from the state of Delhi. Okay, if you look at this statistics, okay, people who are aged below 50 years, not even 1% of them are dying. Okay, not even 1% of them are dying. Okay, so they are doing really well. And the ones who are dying also had some other medical problems. Otherwise, the people who are under the age of 50 years are likely to recover very, very easily and not to have any major problems. People who are above the age of 60, okay, the people who are above the age of 60, the mortality rate is around 6%, okay, which basically means 6 out of 100 patients above the age of 60 did not do well. And again, majority of them had some other medical problems. So this is an important factor that all of you need to know, that people who have other medical problems such as asthma, such as other emphysema or interstitial lung disease or any problem relating to their lungs, and people who are above the age of 60 are more likely to have a bad prognosis. And these people need to take care of their health more than the others, and they need to reach the medical care facility earlier. The next question, which a lot of people ask me, and this is an appropriate time for me to introduce Amitabh Bachchan into this presentation, is why is one person affected more than the other person? You know, I am a 20-year-old guy who has got no medical problems, and there's another 20-year-old guy who also doesn't have medical problems, but one gets bad disease while the other does not get bad disease. What is the reason for that? Well, the reason for that is exactly same as why the death rate in America is different from the death rate in UK, or the death rate in Italy, or the death rate in India. The virus itself has different faces. In medical terminology, we say different strains of the virus, which basically means each virus can modify slightly, okay, and as it modifies slightly, it will affect people slightly differently. Some of the viruses are much more dangerous, some of the viruses are less dangerous, and as we progress into the disease, the virus will keep changing in the way it behaves. That is normal. This happens to almost all the viruses. It has got nothing to do with whether this is a man-made virus or whether it is a natural virus. Okay, the virus keeps changing, and hence whatever virus involves one person, it may dictate on how they present. Also, each individual's immunity may be different in there. So this leads us to another very important point: is how can I stay safe? Okay, there is no magic formula for this. The simplest thing that everyone has to do is wash your hands. Okay, take time and wash your hands properly. Whenever you're coughing, or whenever anyone around you is coughing, ask them to use a tissue, and that tissue paper has to go into the dustbin after that. Try to avoid touching your face, your mouth with your hands. This is something very, very important. Avoid close contact with people, especially those who are sick. You do not want to be in vicinity of them. Stay away from work. Okay, stay away from school or any other place where you may see people who are ill. Eat well, stay hydrated, and get plenty of sleep during this time, because that has a significant influence on your immunity. Now, people really do not understand the importance of hand wash. People do not understand the importance of staying clean with this. This is one experiment which got conducted in Japan, whereby they are putting a invisible liquid in one's hand, which can be only seen in dark blue light. Okay, this is a group of 10 people who've just gone for a buffet lunch, and one gentleman gets sprayed with this liquid, just one guy, and after 30 minutes of people acting normally, we will see where all that glue or that liquid has gone. So I'm just going to play this video. Just see and follow how it goes. So this is the glue being put, okay, which can be only seen in dark blue light. The people are having their normal meal, okay, and they're just chatting. And then 30 minutes later, what you can see in this video is that the glue has spread everywhere. It's gone into someone else's mouth, someone else's face. It is just spread everywhere, and you can see in this video that it is very, very easy. Let me just show this one particular shot from the video where you can see the glue is basically everywhere. This gentleman, whether he touched or whether he passed it on, it is spread to people so easily. And hence, keeping hand hygiene, regularly washing your hands is very, very important in this crisis. Secondly is social distancing. In India, unfortunately, we are not very good at social distancing. Okay, handshakes and hugs are part of our normal culture, but we need to stop this. Okay, we need to start working remotely. We need to stay away from each other for 6 feet. Why do we need to do this? Is this any science behind this? The answer is, when somebody coughs or sneezes, the droplets which come out of one's mouth travel for a long distance. The micro droplets tend to travel as long as 2 meters, which is where you need to avoid yourself from being. The larger particles fall onto the floor, which is not an issue at all. I'm going to play another video which really scares people, and what you will see in this video is, if they are artificially inducing a sneeze, they are artificially inducing a cough in people, and with some ultra microscopic views they are able to see these particles. Let's have a look. So this is a gentleman who's just sneezed.
We can see a large droplet about 1 millimeter in diameter. It quickly falls. But let's look through the high sensitivity camera.
Now when we see
We
it
can
from
see small particles that seem to glitter floating through the air.
seeing it from a different
Let's take
view.
a look from a different angle. They're small and light. You can see them drifting through the air. These are micro droplets. We ran the same experiment on a close-range conversation. The droplets between these two stay where they are. They don't drift away.
So you can see in this image, when people are just having normal conversation in close contact, there are so many droplets which are being transmitted out of one's mouth, and they are in the environment and can easily spread from one person to the other person. This is where the use of mask is very, very important. Now let's just look at this simulation a little bit further.
A person coughs once and spreads about 100,000 droplets. Large droplets are shown in blue and green. Most of these fall to the ground within 1 minute. But the micro droplets, shown in red, continue to drift. This simulation uses only micro droplets. 5 minutes later, 10 minutes later, 20 minutes later, the micro droplets are still floating in place.
空気がよどんでいると、つまり空気の流れがないということで、
See, this is another point where I would like to reinforce the importance of cross ventilation in wherever you are. And these micro droplets which you saw can remain in the air for nearly 20 minutes are something of an importance for anybody entering any room if there is no ventilation. Now, if you look and improve the ventilation in that room, then it will move out.
When you open a window, micro droplets are quickly swept away.
So having cross ventilation is very, very important, so these droplets can be swept away from your work environment, from the environment that you're sitting and at home, or in any position that you are exposed to any sick patient. But the simplest solution for all of this is to have a face mask and ensure that the person opposite you also has a face mask and uses it. Anybody has a sneeze, anybody has a cough, they need to use a tissue and discard the tissue paper after they have sneezed or coughed in there. Workplace safety. Some of you have asked us and say, what about workplace safety? Well, the safest thing is to work from home. Try not to expose yourselves to other people who may be sick. Knowingly or unknowingly, people may transmit this disease. If you have to go into work, or if you are the manager of a work, regular cleaning of surfaces, regular cleaning of the areas is important. Food should not be shared between people. Video conferencing, you really don't want to be interacting with people who come from other parts of the city or other parts of the country, because they may be carrying the virus. So stay clean, wash your hands very regularly, wear a face mask, and ensure that the surfaces are cleaned on a regular basis. Treatment. Well, there is no single cure, okay? But having said that, this is one such disease, like the common cold, like the flu, that it can automatically get cured. The body can automatically cure it in many a people, but many different therapies have been used. While some therapies work for a particular patient and another therapy doesn't work for that patient. So there are different therapies being utilized. We do not have a single definitive cure at one place. So when you hear in the news that one country has found a cure, it may just mean that they treated one or two patients and they were able to cure it. But whether that is able to cure all the patients or not is yet to be proven. Different people will get different severity. There are people who had no symptoms, they were tested positive, they stayed at home, they stayed in isolation, and at the end of 15 days, they got better, there was no symptoms again, they got tested, it was negative. While there are patients who came in very unwell and did not do well on the ventilator. So different patients will have different symptoms, and mostly the medical care is supportive. Hydration, improve someone's immunity, and treat as the problem comes along. Very few patients need a ventilator. That is something I really want you all to keep in mind. It does not mean that as soon as you get it, you are going to die. That's not the case. There is a significant percent of patients who improve and do extremely well. Okay, some patients get cured, and some time later they again test positive and again get this disease. Now, this is a small portion of patients. This could be because of a different virus strain that we spoke about earlier. It could be a different virus strain that could be infecting them, but there is no clear evidence. Plasma therapy is something that you may have heard is being shown to be effective, but we need to see it in larger groups and see whether it will make a difference. There was a question about hydroxychloroquine that is meant to be treating these patients, but again, recent evidence says that it may not be that good in treatment. There are different tablets like remdesivir. Again, all of these have been tried. In some patients they are useful, and in some patients they are not very helpful. What about vaccine? Okay, what about vaccine? Now, realistically speaking, okay, let's be realistic about it. Today we get into a phase 1 trial, which basically means that we start experimenting the vaccine on some patients. The earliest we will get a vaccine is going to be next year, January to April. No vaccine is going to come before that. And this is the earliest a vaccine can be prepared. So when you hear the news that the vaccine is ready, somebody has discovered a vaccine, they basically mean that they have discovered something which could be useful, but we need to do trials. and until and unless we get good results from the trial, it is not going to be manufactured, it is not going to be made available for the general public. Okay, so please don't think that vaccine is available in some other country. They are all in phases of trial as we speak. Now, I would like all of you to concentrate on this section of my talk where I speak about perspective. In Hindi, as people would say, nazariya. The perspective of you towards coronavirus is very, very important, as is shown in this example. The man who is stranded in the middle of the sea with a very small piece of land sees a small boat and he is happy that, hey, there is a boat, it's come to rescue me. While the guy who is on the boat, who is again stuck in the middle of the ocean, and he sees a tiny piece of land and he feels, great, I am saved, this is a tiny piece of land and I can be alive anymore. So it's the perspective of where you are seeing it from, and it is very, very important for you to have a clear perspective. Now, this is the data which is available as of 20th of May from the world, from India and some of the European countries. Okay, what I want you to concentrate on here is in India as of now, 97% of people survive. So it is not a lethal disease. It is not a disease that you get and you die. Okay, in the world, 93% of people have survived. Okay, only 7% of people die. So it's not something that one should panic about. Definitely it's not something that we should take light and say, hey, nothing will happen to me. That is not true. But it definitely isn't a case where somebody gets coronavirus and you say, oh God, he is dead. That is not going to happen. The survival rate is very, very high in this patient. Now, let's look at two different scenarios, okay? I'm going to show you, this is the mortality rate or death rate from road traffic accident. About 1.4 million people in the world die from road accidents, which is around 14 lakhs, okay? Similar statistics, now this is 1.4 lakhs in India in the year 2011. This has increased up to 1.5 lakhs. So 1.5 lakhs people in India die because of road accidents every year. This has not stopped us from going on the road. We still drive our cars. We still get out and travel. Okay. Now, if you compare this with the mortality of COVID, as of now, 0.3 million, okay, 1.3 from road traffic accident, 0.3 million have died from coronavirus. Okay, this is as low as 25% of that. Now, if you look at Indian data, where is 1.4 lakhs and where is 0.03 lakhs as of now. So, it is definitely a disease that we need to worry about, but it is not a disease that we should panic too much about. Now let's look at TB. Okay, TB affects 9 million cases. 9 million, 90 lakh cases every year. Okay, every day we get 24,000 cases. 24,000 cases. Okay, in India, okay, we get around 4 lakh deaths. 4 lakh deaths every year from COVID, from TB. But we do not worry that much about TB, and the same population is vulnerable for TB. The treatment for TB is available, but even with the treatment, so many people die. So my point is, COVID is dangerous, no questions about that, but it is not that lethal that one should really panic. There are people who are committing suicide as soon as they get COVID or coronavirus there is no need for that to happen in there. So this brings into the last 10 minutes of my presentation about some of the facts and some of the fake news that people have been hearing, and we will talk about this in here now. So, does the new coronavirus affect older people, or are younger people also susceptible? Well, the answer is yes, it affects everybody. Okay, the older people are more likely to have worse symptoms, especially those who have other problems like asthma, heart disease, or diabetes. But it affects everybody. So the older people have to be a bit more careful than the healthy younger people. Are antibiotics effective in treating this? No, antibiotics do not work against coronavirus. So please do not take any antibiotics. Are there any specific medicines to prevent or treat new coronavirus? No, there are no specific medicines. There are multiple medicines in trial right now, but there is nothing specific about it. What about garlic? Can garlic help in preventing infection? Well, garlic is useful in improving your immunity. It has some antimicrobial property, but there is no current evidence that by eating garlic you're going to prevent having coronavirus. What about vaccines? Can we use the other vaccines for pneumonia and try that? The answer is no, they do not work in this. Ultraviolet lamps, can we use that to disinfect hands or other areas of your skin? No, you have to wash your hands. What about mosquito bites? Can coronavirus pass through mosquito bites? No, you don't have to worry about that. Coronavirus does not pass through mosquito bites. What about hot and humid climates? India is hot and humid. We will not get corona here. That is not the case. The external climate, whether it is hot or whether it is cold, will not help us. So please do not go exposing yourself to the sun or temperatures just to prevent COVID or prevent coronavirus. It is not a sensible idea. Drinking alcohol-based substances which are used for sterilizing or which are used for anti-infectant, can that be great? No, they do not help. They will cause more damage rather than help you. So please don't go drinking all these bleach products to save yourself from coronavirus. What about adding pepper to your soup or other meals? Well, yes, they will make it spicy for you, but again, they do not prevent or cure COVID for you in there. So, are there any drugs licensed for this? The answer is no. As I said, there are multiple trials which are going on. Then there is nothing that has been proven as of now. So, I'm going to now address some of the specific questions which were asked to us on the registration form. Elderly and vulnerable people, should they take any extra precaution? Well, the answer to that is there is no extra precaution apart from hand wash, cover your mouth, avoid going to such places, and keep your spirits up. That helps in keeping your immunity higher. If you have fever, cough, symptoms, then you should seek medical help. What precautions to take while visiting hospitals? Hospitals are always thought to be an area of infection, and you want to try to avoid infection by not visiting hospitals. Most of the hospitals have now saved areas which are coronavirus free. Those areas are safe, people can go there. There are no special precautions. You still have to cover your face, you have to wash your hands, and you need to maintain social distancing. What about different medications to improve immunity? What about Ayurvedic medicines? Well, none of these have been shown to cure COVID or prevent COVID, but anything which improves your immunity is always good and will help in you tackling the disease. So if there is a medicine which helps you in improving your immunity, then please do take. How good are the tests and how is it done? Well, the current tests are done by taking a throat swab. You put a small tube into the mouth and you take a swab. That is 70% accurate. Okay, so if it comes positive, then great, we know the answer. If it comes negative, in about 30% of cases, we have to do repeat tests and they may turn out positives. There are faster tests which are being developed now, which look at the blood and see if there are coronavirus related antibodies present, but they have not become norm and not available everywhere. We've started hearing news that people wearing masks and doing some physical exercise have struggled to breathe, and some of them faint and fall down. How do we tackle that? Well, it is a genuine question and it does happen. Wearing a mask can suffocate people, can reduce the amount of air that you can breathe in, and it can be an issue for a lot of people. But you have to be careful. You do not exert yourselves too much. Take frequent gaps, and that's the only way you can avoid any secondary complications by using the mask. There is no solution where the mask is not involved. You have to use the mask. Has lockdown been effective? A $1 million question. A lot of people ask me. Well, let me put you in this particular picture. If there was no lockdown, our mortality rates, our case rates as of today would have been many times higher than what it is currently. The lockdown has been excellent in allowing time for the medical personnel to prepare themselves, for us to understand the disease better, for people to get educated, and the government authorities to put checks and boundaries in place so that they can contain the infection. Should we get out of the quarantine or should we continue on the quarantine? That's a very difficult question to answer, because quarantine is not killing the virus. It is basically slowing it down from spreading. So the virus will spread. Whenever you release the quarantine, the virus is still going to be there. So it is up to us individuals now to take all the necessary precautions for preventing the spread of this disease any further. Will it spread through newspapers and letters that you get delivered on the doorsteps? The chances are very minimal. However, it's always good to just follow good hand hygiene after you've touched some other surface. Will we find a permanent cure? More than likely that we will find a cure for this virus, but the virus, as I said, will transform itself into a slightly different variant, and we will always keep adding on to it, keep chasing onto it. And as the immunity increases in the community, where more and more people get infected by this virus, the community will become more stronger in tackling it, and we may not be seeing such deaths in the community in the longer run. Conspiracy theories about the origin, I really do not have any inside knowledge. Whether you believe Trump or whether you believe Chinese authorities or the WHO or the different newspapers, I would like to steer clear of it, because I do not know the truth. What the virus is currently doing, any other new virus can also do the same. How to overcome stress in this difficult scenario? This is a very important question, because stress will reduce your immunity. With your immunity down, the chances of you having a worse outcome is higher. Try to take up a hobby. Try to spend more time with your friends and your family. Try to read something new. Try to learn a skill. I have just started learning skateboarding as of 2 days ago, with my daughter. That is something keeps me busy, and try to do something which keeps you interested. So, in summary, cover your mouth. I think that's the most important thing that you can do. Wash, sanitize your hands, okay, on a regular basis. Social distancing is very, very important. We cannot underemphasize this at all. Single definitive treatment or vaccine is not yet available. It will come, but it won't come before 2021. But the most important thing of all of this is, please do not be scared. Do not be scared, because it is not a highly lethal disease. You are likely to have a good outcome if you follow the normal precautions that I have laid. So, knowledge alone is not power. Based on the knowledge I have given you, you have to take the right action. Then you are going to be in a much better position. Thank you very much. These are my two daughters who are following the social distancing from their parents, and they are covering their mouths as we speak to help in spreading this virus. So, thank you very much for patiently listening to me speaking so far, and I am happy to take any questions that people may have on this topic. I am really grateful for all of you to join in on a Saturday evening. Hopefully, some of you have got some drinks in your hands to keep you entertained during this time. So, I will go through some of the questions that people have asked, and the manner of that, if I'm able to answer many questions, then it's great. If I'm not, then I do apologize. One of the questions which has come is, I am from Maldives. People who tested negative in the area then became positive in India. Why? And why do people without any symptoms test positive? Well, as I said, the primary test is accurate in 70% of cases, and hence, if you are exposed, then it is advised that the test is repeated. If you are a highly likely person to have it, it's good to have the test repeated. So 2 negative tests means you do not have it. 1 negative test means that you should ideally have another test, and if that test is positive, then we treat you as a coronavirus patient. Second question that you have asked me in there is, how can people not have symptoms but be positive? Well, it really relates to the immunity of the individual, that some individuals do not have symptoms but have coronavirus. So symptoms may or may not be present, while you may develop symptoms much after testing positive for the coronavirus. Next question, which has come from Shantini Prabhakaran, thank you for asking the question, is, if cancer patients is affected with coronavirus, when it spreads, will the coronavirus become some other virus? Well, the answer is not clear, to be honest. The cancer will continue in the manner that it is, and the coronavirus will be in the same fashion, and it will not affect either of these in any manner. Okay, this is a hard question which has come from Sakama. She says, please give a suggestion, especially for 10th students who are going to write SSLC exam. How do they protect themselves? Well, children are going to be very difficult. The children, when they are going out of their house, they carry a sanitizer with them, and on every opportunity they sanitize their hands, they cover their face. Make sure you tell them the importance of social distancing, because it is very difficult for them to follow that and really understand the importance of social distancing. Just by using sanitizers is not good enough. People really have to wash their hands in between also. Okay. The next question has been asked by Vanati Govind is saying, wearing a mask and removing it with your own hands, is it not dangerous? Well, the answer is yes, it is dangerous. So it is important when you remove a mask that you do not remove it from your mouth area, but you are removing it from the back around your ears and discard it. And by discarding it, you then have to go and wash your hands. That's the only way that you're going to be able to save yourselves with this in there. If you guys want to leave any feedback, I would be more than happy for you to leave a message on this chat window, and we would be very happy to get back to you if you have any other specific questions that we have not dealt with in there. The other question that has been asked to me a couple of times is that what about workplaces getting open? What should we do? Should we go or not? Well, the answer is yes. If you can avoid it, then please avoid it. And if you cannot avoid it, then you have to take all the necessary precaution before you go into workplace. One question by Kadir Kadiresan is, do we have second and third wave of COVID? Well, it is highly likely that we will have second and third wave of COVID, and it may be something which is premature for us to talk about whether it will be much worse or whether it will be better, but we will have to look and see how the data is coming out of South Korea and China, where the second wave has already started to manifest itself. Next question is coming from a very dear friend called Ankit Piplani. Ankit asks, post-recovery, any permanent damage caused to organs, or is there 100% recovery? Most of the patients recover well without much symptoms or any damage. Some of the patients who are in the ICU or who are ventilated do end up having some damage to their lungs. How long will they last? How badly they will affect the patients is yet to be seen, because we are very much early in the disease pathway, and we will understand that bit later as we get more data out of that. Jairaj Dhanashekaran is asking me, sir, mild throat pain, only breathing is not problems, or do we have a remedy? Well, isolated mild throat pain or a body ache without having any fever is unlikely to be coronavirus. Okay, I would still give it a day or 2 days, practice social distancing and hand hygiene, and if things do not improve, then I would seek medical care to get a better understanding in there. So, Dr. Iqbal Darzi, thank you very much. He reinforces my point, saying that right knowledge alone is not power, but applied knowledge is power. So, yes, please apply the knowledge that you have been given today, and that will be useful. Syed Umer asks me, what is the situation of the acute cardiology patient in this pandemic situation? Syed, you raise a very important point. Now, a lot of countries have faced an issue where, because of the fear of coronavirus, some of the patients have struggled to get the right medical care. People have not reached the correct hospital in time, or the hospitals are waiting for clearing out coronavirus before they can start treatment. But our hospital, Narayana Hridyalaya, we have managed to create very robust policies, and every patient who comes to us gets treated appropriately, and we make sure that they get the best care whether they are positive for coronavirus or not. Karnataka has been fortunate in not seeing that many coronavirus cases as of now, but places like Maharashtra and Delhi are struggling with the healthcare delivery, but we can I can assure you to a high level of certainty that every doctor is out there trying to do their best, trying to make sure that they can provide adequate and appropriate healthcare delivery. So, if you have other medical emergencies, please do not stay away from home. Please do not avoid a medical care facility. Seek medical care facilities. We are all prepared to deal with such crisis, and we have specific policies to keep patients away from those who may have coronavirus in there. So we are at 7 o'clock. I think I'll just look for one question and we can stop this in there. So, is plasma therapy successful in treating people? Well, the answer to that is yes, it has been helpful and successful in treating some of the patients, but whether it will be helpful in treating all the patients or not, it is not certain, and we cannot be sure about this at this stage. So, I would like to end this session by saying thanks to Prof. Malathi from the Center for Skill Development, Annamalai University, and Mr. Rajan Jayaraman from MedEmpower to put this whole program together. And I hope you guys have learned some of the facts related to this, and it makes you better armed to tackle this situation. Thank you very much for being part of this webinar. Goodbye.